Hi everybody, it's Dr. Dan Lieberman at Palindrome Spine Care for Life. I'm here today to talk to you about facet arthropathy, which you know as good old-fashioned low back pain, mechanical low back pain. Although so many people have it, 8 out of 10 Americans experience this at some time in their life, let's take a minute to talk about what it is, what it feels like, in large part to distinguish it from some of the other things in the back, like disc disease or nerve root problems. So everybody knows what back pain feels like, almost everybody, unfortunately. It's a pain in your back that feels like it goes into your buttock area. Most of the time, the pain almost feels like it's in your hip. In fact, most patients who come in here have x-rays of their hip already that are normal. A lot of the times the pain will also burn in the outer part of the thigh, and in some cases there'll also be some other pain in the leg. But the dominant thing, the main thing, is the pain in the back that goes into the buttock, feels like it's in your hip, and burns on the outer part of the thigh. What causes this pain? It's pain from a joint. If you look at a typical spine, this is a model of the human spine that's life-size. This is the sacrum, and these are the hips. This is the spine from the back. These spinous processes are the little bumps you can feel rubbing someone's back along the middle. Off to the side is a joint, and this joint is called the facet, F-A-C-E-T, facet joint. And the facet joint is very small when you consider how much weight it holds for the rest of the body. When the facet joint becomes arthritic with aging, or if it's injured, or if you just move the wrong way and strain it, it starts to send off signals of pain to the rest of the body. What happens next? Well, whenever you have a problem with a joint, the muscles around that joint are going to go into spasm. It's your body's mechanism of stopping that joint from moving, of bracing it. But when that happens in your back, you get that achy feeling that goes across your back, and because it's muscle pain, just like heart muscle pain can radiate into your arm, back muscle pain can radiate into the outside of your leg. Well, what do? How do you treat it? I like to think about the treatment of this problem in basically 3 stair steps. And the first step is what's called conservative care. That's anti-inflammatory medications. Often a brace, the kind you can buy at the hardware store, can be helpful. In a medical setting, we have better braces that can help support your back for a short time. And physical therapy is extremely useful. In the beginning, physical therapy tries to reduce the pain and restore movement, but over time it can teach you ways of using your back that make future flare-ups a lot less likely. Well, what if that doesn't work? So you go through that process for 3, in some cases as much as 6 weeks, and you still have pain that is preventing you from doing the things you want to do in life. Well, the second step of treatment is a little more invasive, but still minimally invasive, and I call that medial branch block rhizotomy. And what that means is a medial branch block is an injection that we do under fluoroscopic guidance, under x-ray guidance, to the nerves that go into the facet joint. If you have a medial branch block and we localize properly the joint that hurts, you should have absolutely no pain in your back, but only for a few hours. You can think about this as if you're having a root canal for your tooth. If you numb up the tooth and you don't do anything else, yeah, the pain will go away, but a few hours later when you start to feel your lip again and the nerves come back, the same pain would be there. It's the same with the low back. If we numb up those nerves and the pain goes away, and then a few hours later it comes back, we know for sure which joint is hurting you, and that's what we need to know to go to part 2 of that treatment, and that's called rhizotomy. Rhizotomy means cutting the nerve. No, this is not one of the nerves that goes down your leg, and not one of the nerves that provides sensation or motor movement in your leg. This is the nerve that goes only into the joint. So when we cut it, you still have the joint, and the joint still works normally, but you can't feel it anymore. How is rhizotomy done? Rhizotomy is a surgery. We put you in an operating room. You go under a dense sedation. We prepare your skin normally, make a small incision, and put an endoscope down to where the nerve is. The endoscope is about as thick as a pencil. With the endoscope, I can see the little nerve as it goes into the joint and directly cut it. It's a very effective treatment for this problem. Another way to do rhizotomy is to put a needle in the spine, and then you can't see the nerve, but you can get close to it using X-ray guidance. And in that technique, you heat up the tip of the needle to burn the nerve. It's very safe. It's not as effective as you might imagine. If you can physically see the nerve, you have a better chance of taking care of it than you do if you don't see it. But it's still pretty effective and a very good treatment for this kind of pain. Well, let's say you go through a brace, anti-inflammatories, and physical therapy, doesn't work. You have a medial branch block and a rhizotomy, and it works for a while, but eventually the pain comes back. The third step and the end stage of that is to actually have a fusion of your back. Fusion surgery is much more invasive. We've talked about it in other videos, and I'll refer you to those videos on spondylolisthesis with stenosis for further reference on that. But the vast majority of patients can be treated with just the conservative care. Some go on to require the rhizotomy, and a very, very small few end up requiring the fusion. That's it for today on facet arthropathy. This is one of the most common medical problems in America, and it's one for which we have really good treatments, but you have to be treated. Once that treatment ends, you start the exercise, and for that I'd refer you to my blog at Blogspot Palindrome Spine Care for Life. Thanks for being with me today, and have a great day.